Welcome to another episode of the Make Mental Health Matters show. I'm your host, Kelly Melissa Reinhardt, and you get me today all by myself. I'm doing a solo show. I have had several guests on in the past, last week we had two, which was awesome. And if you've been following along, I have been sharing information about our Love Life Live program that we are rolling out. It is launching. We got the app officially on its way, which is so exciting. It's only taken, I don't know, like 6 months, but it's finally on the way. So we're going to have an app when we're going to be able to launch. And if you didn't tune in to last week's show or the week before that, make sure you go back and watch, whether you're going to watch on E360 TV, YouTube, or our Facebook page, or you're going to listen on Dream Vision 7 Radio. Either way, make sure you go back and watch because I'm not going to try to rehash it. I do want to talk to you today about some things that really have come into my not vision, but into my knowing. I'm just gonna make up words and phrases today. It's cool. But there are people, and I know I've talked about this a lot on the show, but there are people struggling at alarming rates right now, and I can say firsthand that it is or feels like it's getting worse. I'm going to share information of how we might be able to help others. I always try to do some piece of education on the show because you only know what you know, and we always do the best that we can with the resources that we have available at the time. And sometimes in those times, we don't have a lot of resources and we're not really sure what to do. So, if you've ever had that experience that you have somebody in your life that is struggling with a mental health challenge, or maybe they've just come to you and mentioned that they are harming themselves, or maybe they just express that they actually have suicidal thoughts, whatever that might be, I want you to feel like you are able to help them. I want you to feel like you have that tool, you have tools in your tool belt to be able to help and support that person without having to call myself or call a friend, or which is always good. But really making you feel confident so that you have what you need to actually help somebody. So, I wanted to spend a little bit of time today on talking about that specifically, is how do we help ourselves potentially, or how do we help somebody else that's in our life? And again, the reason why I'm saying this is because just in the last like 2.5 weeks, I feel like I have given out the Make Mental Health Matter website more than I have in probably the last 2 years. One, there has been lots of people that are like, oh my gosh, their kid just told them that they're self harming, or oh, they're having these thoughts about hurting themselves, or whatever it is. On the other side, I've had multiple people, just even in my vicinity, my networking groups, people that I know that have reached out and said, oh, yeah, so and so just took their life, or my friend of a friend just lost their husband or their child, or their, it's been so many, actually 8 total, not like far distant people, like people within my network, within my circle, that know somebody that either died by suicide, or they know somebody that knows somebody that just had a loss. And so I have felt there's a lot that's happening right now. There's a lot that's happening in the planets. There's a lot that's happening during this time of year. But I don't know if you know, I may have talked about this, but most of the time we lose people within 30 days of a period of improvement. So not when they're like way down in the dumps, not when they're like super depressed. Like that's not generally the time that we lose people to suicide specifically or overdose. It's usually when they are getting better, like when things are starting to feel like they're improving. So I'm going to take a situation, talking about substance abuse. So I talk about overdose as suicide. And I do that because whether you are slowly killing yourself by taking in the drugs or whatever substance it is, it's over time. Most people, or not most, but a lot of people who die by overdose, is once they've like gone into a recovery program and they've been in it for maybe 30 days and then they get out and there's no follow up. There's no community that they're making. There's no connections with their social workers or with the people that they just spent 30, 60, 90 days in facility. And they go out and they're like, well, I'm better now. I'm good. Like I can go use again. It's cool. I'm fine. Like it's not going to affect me. And then they try to take the same dose of what they did before they were clean. So their body has now like flushed out all of those chemicals, all of those substances, and they're over time in the past they had built up this tolerance. Your body naturally does that. It builds up this tolerance. So if you are somebody who has ever used substances or you've drank, you might have noticed that over time, like you can drink another one and you feel fine, or you can drink another couple and you feel fine, or whatever it is, right? Our bodies build up this tolerance. And that's why substance use, they go from one substance to another substance that's a little bit stronger, and then another substance that's a little bit stronger, and then another one that's like the most potent out there, right? Because their body is building up tolerance over time. And so they have to continue to increase what they're taking to actually get that same effect of our brain, that euphoric effect that they're going after, or maybe the numbing effect, or whatever it is that they're trying to use this substance for. And so their body can sustain a lot more substance in it without overdosing. However, now they've been in this recovery center for 30 days. It's inpatient. Now they're going outpatient and they go back and decide that they're going to use again. And they think about when they were or where they were before, and they try to use that same amount of substance. And that's when they overdose. Most, not always, but a lot of times that's what happens. So um if that is helpful in any way, the same goes with, not same, very similar. Let's see if I can explain this. But so with a mental health challenge, so you are, let's say you start having early signs and symptoms of a mental health challenge. um I'm gonna use anxiety because that is maybe a little bit easier for people um to connect with. So let's talk about like youth. So youth, generally, anxiety shows up in stomach aches. That's one of the symptoms that ultimately your kid may be reporting back to you, that, or you're noticing every single Sunday night they happen to get a stomach ache on Monday morning when they have to go back to school, or they're just like not eating as much and they say that their stomach really really hurts them. Well, anxiety in youth can manifest through different symptoms like a stomach ache. So if your kid is constantly complaining about stomach aches and they don't have anything physical or that's been diagnosed that could be like internal of why they're getting stomach aches, you might want to look at what are they thinking about? How are they feeling? What's going on at school? Is there maybe Are they having trouble with a bully? Are they bullying themselves? Like, not themselves, but are they being a bully to others? Is there what's going on in their environment that's causing them to feel anxious, and it's ultimately manifesting in their stomach? Are they forward or future thinking? Are they always worried about what's going to happen at school? Or are they always worried about what's going to happen with their family? Or are they worried about where they're going to get their next meal, or how they're going to get to school, or all of these things, all of these elements are creating this worry or this anxiety because they're future thinking. They're thinking about all the things in the future that have to be done, and it's creating or manifesting these symptoms of a stomach ache. It can also create vomiting. So if they're throwing up often, it can also lead into other challenges like eating disorders, and there's, I mean, all sorts of different things. But ultimately, what I'm saying is that we have to look at these things that move into um, or progress over time. So maybe it starts out with, I don't know, not feeling the best, not wanting to go to school. And then all of a sudden they're waking up with stomach aches. And then all of a sudden they're throwing up every day. And then all of a sudden they're like, they can't leave the house. Like, they're so frightened to leave the house. There's so much social anxiety. There's so much just anxiety in the future. They're worried about everything. And see how they kind of like keep layering it up, right? The same goes for mental health challenges, which ultimately they can either go like, they can get worse over time. So if you think about depression, if you're like, I'm not really feeling that great, like I feel kind of sad, but I'm not really sure. And then it starts to get longer, like the period. So the time frame for when we talk about clinical depression is 2 weeks or more. So if it's something that lasts for 2 weeks or more, I think I said that right. It's either 2 or 4 weeks. I think it's in between those times. But 2 to 4 weeks, if it's lasting for more than 2 to 4 weeks, like people can feel sad, but it doesn't stick around as long, right? Like every single day is a new day. So we could have new emotions every single day. Maybe yesterday something triggered me and I got sad. Well, tomorrow is a new day. So now I'm happy, right? But when you're in periods, so long periods like 2 weeks, 3 weeks, 4 weeks, and so on and so forth, the depression, right, it starts spiraling. First, it's like, I'm just tired, I'm exhausted, I'm not really feeling great. I'm like really worried, I'm sad, I'm just not, not, I don't know. There's just, I'm like, I have no emotion. I feel emotionless. Then it keeps going. And it's like, now I'm super depressed. Like, I can't get out of bed. I can't move. I can't function. I can't even go to work. I can't go to school. I can't do anything, which leads into, hopefully, like, where we want people to get is that they're searching out or seeking help to feel better. Well, once we go to search out to get the help to feel better, when we start coming back up, so like if I take anxiety and we're like spiraling more, our anxiety is getting worse, or the depression, we're getting more and more depressed and more depressed, and there's no light at the end of the tunnel. But then we start, maybe we add in some coaching, maybe we add in some therapy, maybe we add in some massages, maybe we add in going out and walking every day. Maybe we add in just taking a shower every day, right? We start adding these things in that are starting to make us feel a little bit better. And then there's, as we're improving, so we have this period of improvement. Going back to the substance use, is like the period of improvement is that 30 days in patient. Then when we shift into this period of improvement, that's when we lose. I'm bringing it back, I promise. That's when we lose the most people who die by suicide. And that has been researched and proven that it's that 30 days within a period of improvement that we tend to lose the most people by suicide. If you think about the substance use, that's when we lose the most people to an overdose, right? Like they try to go back to the same amount that they were doing before they got better and their body flushed everything out, but their body can't sustain that anymore. So they overdose. And if they don't have Narcan on hand or they don't have a way to get out of that overdose, then they die. And that's why I talk about overdose as suicide, because it's either unintentionally quickly where they die, or they're slowly over time killing themselves. And unfortunately, they get to the point that they overdose. So the same with depression, anxiety, whatever mental health challenge you want to insert. We need to be hyper vigilant during the 30 days of a period of improvement. And if you look at that or reflect on that as a caregiver or a helper or somebody that's taking care of somebody who experiences a mental health challenge, and it's really heavy to be in that space, and then all of a sudden it feels like, well, everything's getting better. Like, oh my gosh, they're finally doing the thing. They're finally taking a walk. They're finally getting out of their bed. They're finally taking a shower. Like it's like the floodgates of heaven have opened because we feel a little bit lighter, because they feel a little bit lighter, but we still need to be aware of that period, because that's unfortunately when we lose the most people, because now their brain is thinking a little bit clearer. And that's the point where I think, and I'm not a researcher, I just know this information based off of education, all the certifications that I've taken, and by doing a whole bunch of workshops. But they have said that based off of research is that when their brain shifts into the action of taking their own life. So, why am I telling you this? Because I think it's important for us to understand how the brain works first and foremost, but also as caregivers, helpers, people that are in the community, helping others, responding to others, we need to be aware of that time frame. So again, that's 30 days of a period of improvement. It could be longer, right? It could be 45 days, it could be 60 days, it could be 90 days. But I want us to be aware of that time frame of when they're starting to get better. How can we, as helpers, as caregivers, as people that just care in general, be aware of that time frame? So, I'm going to go to my quick first sponsor break, but once I get back, I want to share with you how you can know all this information. Obviously, you can go back and watch this at any point in time, but I'm going to show you a couple pages on our website that will give you a little bit more information as related to the verbiage, the things that we should or should not do in non-crisis, crisis, after an attempt, and after a suicide, and just share those with you because I think they're really important pages on the Make Mental Health Matter website that maybe you didn't know about before, and maybe you have people in your life that could really, really use this, or maybe you could use it. You want some reading material to get yourself educated. So I'll be right back after this quick sponsored break.
Have you ever felt completely alone?
Like your life doesn't matter.
One person dies due to suicide every 40 seconds.
You are not alone. Call the National Suicide Lifeline at 988.
Hope and recovery is possible.
1 in 8 people globally live with a mental disorder.
That's why empowering minds saves lives.
We need your help.
With only $19 a month, you help us save lives through mental health and suicide prevention education.
Scan the QR code or go to makementalhealthmatter.org to sign up as a warrior for mental health today.
I'm Sinette from Bredar. I'm from Johannesburg, South Africa. Please join me in my Power Hour every Sunday, 12 o'clock Pacific Standard Time on E360 TV. Mwah!
And like that, I'm back. If you happen to be just tuning in to the Make Mental Health Matter show, thank you so much for watching or listening. You get me solo today. I know you're so excited. But I am talking about I'm trying to give you a little bit of education, a little bit of information around how to help somebody that might be struggling, whether it is with substance use or suicidal ideation, and how we can, as caregivers, as helpers, as people that care about other people, really truly help somebody when they are struggling. So, I just talked about that 30 days of a period of improvement, but there's a lot of things that during this time when we are helping somebody, and I want to also kind of caveat this with, at least for me, and you might be different, but I know personally it is the hardest for me with the people that are closest to me, because we're in relationships, we are in like with family, right? You're with them all the time potentially, so you don't notice maybe everything that's going on, but you also have this unique perspective that you do notice and you see things that are going on. But it is definitely, or can be, more challenging with the people that are closest to us to really start to notice these things. I think it's almost like with coworkers or um people who are in your collective sphere of influence, they tend to be maybe a little bit, I guess, easier to spot these type of things, but it's definitely good to have the information and know how to help somebody. So I want to show you on the Make Mental Health Matter. I haven't done screen shares on here, so we're gonna see how this goes. I want to show you a couple pages that are on our website so that in the future, if you ever need to utilize these pages on the website, you'll know where they are. So, on the Make Mental Health Matter website, so under resources, so you're going to probably land on our homepage here. And under resources, we have a couple different tabs. We have our trusted resource hub, which are our experts, our people that we refer to more often because we trust them. We know they're going to be helpful and not hurtful. And we know that they're going to take care of anybody that we refer over to them. So you can always check that out. We also have our free download. So if you are somebody who experiences or is struggling with a mental health challenge, and you need reminders on a daily basis, we have our 7 strategies for mental wellness, which includes a safety and self-care plan, which is a great tool to have. But I want to direct your attention to our non-crisis, crisis support after an attempt and after a suicide. So on these pages, it has a whole bunch of information like how to help somebody who might be struggling with mental health. But on the non-crisis is like before they're in a crisis. Hopefully you understand that. So it's really that early intervention. It's the prevention. That's what we call it, is prevention. Because the earlier that we can help somebody, the earlier that we can get them the help that they need, the better outcome that they'll have. And so these are just some helpful ways when people are not in a crisis. We want to be direct, always be direct, but compassionate in the way that we are having conversations, the way we're communicating with people. And there's even words of like how to say it or how not to say it. And it's really like, hey, I don't know everything. I'm not exactly sure what to say, but I'm curious. Do you want me to just listen? Would you like to come up with ideas? Do you just really need somebody to listen? Or, wow, that sounds really hard. I'm not really sure what to say. We don't have to have all the right words, right? We can simply be that listening ear. And sometimes that's what people really, really need. We also want to listen without judgment, right? Like, I don't need to give you advice unless you ask me like specifically for advice, but I don't need anybody's advice. I don't need you to tell me, well, I used to walk up here both ways in the snow, right? Not really helpful. Your advice is not helpful. Excuse me. Um, but we can give them facts. So, like, hey, I don't really know how to help you, but let me show you a couple things that I have learned in the past, and I'm going to give them the facts. Or, hey, I've noticed that you've been really sad lately, or I've noticed that you've been really down lately. Is there something that you'd like to talk about? That's a closed ended question, but trying to get them talk a little bit more talking. So, listening non-judgmentally, it's not as easy as you think it would be. Listening sometimes can be really hard, and I'm sure some of you that listen to this, you're like, I don't know, sometimes it's really hard to listen. But listening non-judgmentally is a whole nother skill of, like, I'm going to listen without inserting my biases, without inserting my beliefs, without trying to fix you, without trying to make a solution to the problem that you're having. Like, I'm going to just listen non-judgmentally, and I'm not going to try to fix you. People are not broken. They don't need to be fixed. But they may ask for some advice. If they do, that's great. But listen, validate their feelings. Oh my gosh, that sounds really hard. Or wow, that makes a lot of sense what you're saying. Um we don't want to, like, add in, let's see, what does anyone going through this would feel overwhelmed? Sure. Yep. And your feelings are valid. We're asking those open-ended questions. Again, I already said that. But getting them to talk more, not close. So, how are you doing today? Great. How are you doing today? Great. Whether you are great or not, that's what we say. So, how can we ask the open-ended questions to have them tell us more? So, tell me more about what's going on. Tell me more about that situation. Wow, how has that been making you feel so overwhelmed? Like, what is overwhelming about this situation? Right? Um, we do support youth a little bit differently. So this just tells you a little bit more about youth and how to support them a little bit different. And then I always love to encourage, like, if you're not in a good place in yourself, don't try to help somebody else, because you could actually make the situation worse. So know your capacity. Like, are you in a place that you can actually help this person? And if you're not, it's totally okay. This is a non crisis space. And so you don't have to have that capacity. If you're like, I'm maxed out, like, I can't deal with this right now. I can't help them right now. Like, I'm already at my max. Like, if I try to help them, I'm probably going to do more damage. And so know your capacity and be able to express that. And the hope is that the other person on the other side will take that in and be like, oh, well, I appreciate you being honest with me. And then maybe it's like, hey, so and so, I know that they're a great listener. Like, can I connect you? Or, hey, is it cool if, like, we put a pin in this for today just so that I could get some rest, and then tomorrow we can have a whole conversation? Would that be okay? Right? Again, this is non-crisis, so we're not having to make people talk. We don't have to talk ourselves, and we can put a pin in it and investigate later. But this is also a really great space that we're, like, planting seeds or letting people know that we're here when they're ready to talk. And maybe they're not ready to talk at that point, and that's okay too. So there's some reminders here. Then when we go to crisis, so Make Mental Health Matter, we don't specifically do crisis support. However, we can train you as individuals how to support somebody in crisis. So this page just gives you, again, some great words that you can ask. These questions over here: are you going to kill yourself? Are you thinking about suicide? Yes, they are very direct, but there's a point and a reason why they're direct, because they're very, very clear on what you're asking what you are wanting to know from them, and our brains love clarity. There is also just telling you more about why asking direct. Then it gives you the follow up questions, the how, the when, the needs, or the means. We're going to want to find out more information. Most people that I have found actually, they won't give you all of this information, but it's good to have, knowing if they have a plan or don't have a plan. And then timeline, like if they're like, well, it's going to be like 2 weeks, don't be like, "Oh, okay, good. I got like 2 weeks. I can figure this out." No, no, no. We're in a crisis now, and we need to get them help and support now, because just because they said it'll be 2 weeks doesn't actually mean it'll be 2 weeks, and they need help right now. So, if you have to call 911, 988 is great also, but when you call 911, and I think this is really important, I love to tell people this, is please ask for either an officer or a first responder that is trained in a mental health challenge. Or I know in Colorado, we have mobile mental health crisis teams or mental health advocates. Ask for them, ask the operator, and let them know that what the situation is. Hey, I have somebody that is suicidal here. Here's the situation. This is what I need help with. So if you have to call 911, please ask for that, just so that we know the call is going to be beneficial for that person, and not go the opposite way that we've unfortunately seen in the past. We're not guilting anybody. We're not shaming them, right? Like, I used to, I will tell you, back in the day, I was like, if anybody ever kills themselves, I'm never going to their funeral. Like, that was me just being naive, not knowing what the heck I was talking about. And that wasn't fair. That wasn't good. It wasn't something that I would ever repeat again, right? Like, I just didn't know. I didn't know what it meant. And of course, I mean, now my sister died by suicide, right? Like, I went to her funeral, but that was just me being naive. Or I hear other people say, well, um, you can't leave because of me, or you can't do that because of whatever, right? Like, they have a reason why they feel that way. So don't try to shame or guilt them or lecture them or any of those words. You can also say, like, we can call together. You could call 988 and get support to help you walk through the conversation with whomever you're helping, or you can call together. But there's a lot of information here that really get you the help or support. We also aren't all about reinventing the wheel. So there's a whole other section that we collaborated with American Foundation of Suicide Prevention. They've given us permission to add their PDF on our website, so you can go check those things out. They have a whole bunch more things that you can do when in a crisis. And then if you need immediate help, again, here are all of the numbers. So I need to go to my quick last sponsored break, but once I get back, I'm going to show you 2 more pages, and then I have an ask for you. So I'll be right back after this quick sponsored break.
1,917 people die daily from suicide globally.
I lost my middle sister, Kelli, to a completed suicide on February 20th, 2017.
How does Kelli, host of the Make Mental Health Matter show, impact lives?
Number 1. Awareness.
My story, however, it isn't unique. I am a domestic violence survivor and a recovering addict. For 14 years, I was in active addiction, and because of Kelli and the work that she does and the opportunity to have my voice heard, I was able to stay clean and sober and have hit a year. I'm still here, and if it wasn't for Kelli answering my call the day that I thought I was going to take my life.
2. Conversation.
I'm curious, and I know that I've heard a lot in the BIPOC community, it is very hush-hush. It's like one of those things that you don't talk about. Like, you literally feel like it's not a conversation you can have. So can you talk a little bit more about that?
First, shout out to Kelly because I'm glad that she asked the question. I researched you before I went on your show and I saw how real and authentic you were. And I just appreciate the question because it is different and we have to have tough, courageous conversations. So, yes, I always say I'm a triple diversity threat. I'm a Black woman with multiple disabilities. Now, I'm not really a threat, but to other people, I may be because people fear the unknown and what they're uncomfortable with.
Number 3. Education.
Kelli's passionate commitment to mental health awareness is a beautiful thing. It's clear in her social media posts, it's clear in the resources that she puts together, in the activities that she provides, her collaboration with organizations, and the consistent way that she continues to deliver a message encouraging people to understand that they can share openly and to break the stigma around mental health. Kelli's topics cover children and adults, talk about things that we can do as a community, things that we can do individually, and her website is packed with information and resources and all kinds of contacts that you can use to reach out, whether you're dealing with something yourself or you're looking to help somebody else who is struggling. I encourage you to check it out.
And like that, I'm back again. If you happen to be just tuning into the Make Mental Health Matter show, thank you so much for watching or listening. You missed the whole beginning of this, so make sure you go back and watch it. All right. So I pulled up a couple, not, well, yeah, I went over two so far of the pages on the website, but now I want to go to after an attempt, and I'll just show you these briefly. Again, we're not trying to reinvent the wheel by any means, but we want to make sure that people have the information that they might need in the future to help support somebody. So this is supporting a loved one after a suicide attempt. This is guiding spouses, parents, family members when somebody attempts suicide. So oftentimes I have a lot of people that reach out to me and they're like, so and so just attempted suicide, or so and so just said that they have suicidal thoughts, or so and so just said they want to kill themselves. This is a great space for you to go to find out, like, what do I say? What do I do? How do I help? All of this is really, really, really great. So, how can you be helpful? How can you help somebody else, whether they're the ones that attempt or they're the family member of the ones that attempt? So take a look at this. There's quite a bit on here. And then again, we're going to ask some of these questions directly. We're going to make sure that we are giving clear questions, instructions to our brains to be able to process the information. We don't want to like skirt around because we feel uncomfortable asking the questions. We really want to ask directly. So it also has what's not helpful. We don't want to minimize their pain. Oh, you're fine. You'll get over it. If you, right? Like, I feel like we hear that, rub some dirt on it. You'll be fine. It's fine. Or we're like, oh, well, you should be grateful for blah, 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 right? That's not helpful at all whatsoever. Don't do it. Don't be a jerk. Don't do it. And then listen, it may be really, really overwhelming for them. And I don't need you to fix me. I just need you to listen to me. I just need you to be there. And I need to know that somebody actually cares about my life. I need to know that somebody actually values me. I need to know that I'm not freaking alone in this world. Like, that's what people need. They need to know that somebody actually gives a crap about them and their situation and isn't always trying to fix them. Sorry, I just went on a freaking tantrum. Tantrum. I threw a tantrum. No. But it's true. It's like we have some, well, it's really not that bad. I don't understand why you would even do this. What, you're not even thinking about your kids, you're not thinking about your family, you're not thinking about me. It's not about you. It is about them. It is about what they are going through, and that's what we need to focus on. So, I want to give you your power back. I want them to have their power. And I want you to feel confident when you go into these conversations. So there is a framework that is on here, helping them immediately. Then, when we're really looking at that stabilization, how we're looking at long term support. This is not something that just stops tomorrow. This is something that could be a lifetime. This is something that they may have these feelings that come back up. It's not just going to go away, it doesn't magically just disappear. So, how can we actually help somebody? And then the last page that I want to direct your attention to is after a suicide. So now the unfortunate thing has happened, like in my family, and somebody has died by suicide. And so, how do we help them? And this is the other one that I get all the time is like, I want to give them some resources. I'm not really sure what to say. I don't know what to do. How can I help so and so? Well, I want you to pause for a moment, because after a loss to suicide or a death of this nature, could be again an overdose, it's very overwhelming to be on that side. And again, I say that from experience of like, I was just trying to figure out what the heck happened that day. I was trying to figure out how I help myself, how I help my family. What do I do? What's going to happen with my sister? What's going to happen with her kids, right? Like, there's so much that happens in a short period of time that we've got to think, I'm not even gonna like hand them anything right now. It's the after that we need people. Like, everybody is swarming. Everybody, like, at least for after my sister died, it was like Facebook messages and this and that and this and that. And it was like so overwhelming. Like, I couldn't keep up with it. And I was like, y'all, just stop. Like, just let us be. Like, just let me have a moment. And it took a good like year to get to the point that I didn't. I mean, I still even have moments. It's 9 years later that like the fog, like that's what a lot of people call it, is it's this fog that you kind of go into and you're not really sure what's going on. And there's like the lifting of the fog occasionally here and there, and it's so interesting that even 9 years later that there's still some fog around what happened in those moments. So just keep that in mind. There's a lot of words on here that we shouldn't be using, like they're in a better place now. If you said that to me after my sister died, I probably would have punched you in the face, honestly. Or everything happens for a reason. I would have used some very strong words and language had you said to me. And then the you must have missed signs. You have no idea, as a suicide loss survivor, how bad we beat up on ourselves right after. You're like, oh my gosh, like, what did I miss? What is happening? How did this happen? How did I not see this? We do it to ourselves enough. We don't need to hear it from you. So, these are some good things not to say. And then I give you some options to say. So, take a look here. There's some gentle reminders. As a suicide loss survivor, for me, when people are like, I'm so sorry for your loss, I was like, I don't need you to tell me I'm sorry or that you're sorry, because you didn't do anything. So keep in mind the words that we're using. So there's a lot of stuff on here. There are things for people that are like outside of the direct suicide loss survivor to be able to help. And then there are also recommendations, thoughts, things of or for people who it's like their family member or their loved one or whomever, right? Like if they're the direct suicide loss survivor. So and then talking with your kids and your teens, again, not trying to reinvent the wheel. So this is another great American Foundation of Suicide Prevention PDF that you can check out. They've got a lot of ideas on there too. So again, this is under resources. So if you go to mmhm.org, go under resources, there's non-crisis, crisis, after an attempt, after a suicide. I'm going to update a couple things here just so it's a little bit easier. So if you're like, well, I'm not the direct suicide loss survivor, but I want to help a friend who is, I'm going to make some buttons at the top just so you can jump and you don't have to run or read through all of this. And then if you're curious and you want to know more of the stats, more of the research, all of the things behind, there's some stats in here too. So just directing your attention to those pages. And then the last thing that I want to direct your attention to is, I know I've already talked about it, but our Love Life Live program, it is coming up. We are launching it, and it's rolling, which is so exciting. You can sign up for coaching, you can donate. So if you didn't listen to the last two shows, we are raising $30,000 in 30 days. We need your help to launch this program. And everything that I just talked about is the exact reason why we need the funding, because there are people struggling at alarming rates. There are people that are dying by suicide on a daily basis. There's 100, I mean, based off of the 2024 stats, it's about 135 people in the United States who die by suicide every single day. 135 people in the United States who die by suicide on a daily basis. And so we need to give people access to resources. We need to give people a space that they can go to feel safe, to talk to somebody that's not going to cost them an arm and a leg. And the solution that we have found and the gap that we're trying to fill is that 30-day space when they can't find the help that they need to get. And that's where the Love Life Live program comes in. We're filling the gap with our program through coaching, through holistic based services, but we can't fully launch this program without your help. So my ask for you is, even if you can donate $5, right? Like $5 is wonderful. So if you can help us, or share it with a friend, tell your buddy who's a millionaire. Go share it with them and tell them that they need to donate to the Love Life Live program and to make mental health matter, so that we can ultimately, what these funds go towards is paying all the back costs, because there's a lot of back costs, the technology that we utilize, getting all the coaches on the platform and making all the connections. But then also, we want to offer 4 free coaching services, or 4 free coaching sessions to each person that comes into this program, but we don't have the funding to be able to do that yet. So we are launching without the 4 free sessions, but we want to be able to launch and give those 4 free sessions to anybody that might be struggling, because truly, having access to something can actually save lives. And so we would love to have your support in raising $30,000 in 30 days. So this page itself is going to move to its own page just so that it's not all cluttered in here. But if you want to learn more information about the Love Life Live program, you can go to this page and learn more. And please support the program so that we can ultimately help more and more people. The more money we raise, the more people we can help, the more that we can help in the space of wait lists, the more that we can start really desperately save the lives of people that are struggling, that don't right now have access to the mental health services that they need. There are way too many people that are dying. There are way too many people that are struggling. And it's like, now is a time we have to start helping the collective. We have to start giving them the resources, the information, the coaching, the things that are going to actually save their lives, the things that are going to start shifting and making changes in their life. And that's where the Love Life Live program was born. So that's my ask for you. If you've been watching or listening to this show for a really long time, please, I invite you to help us make a difference in the lives of people by donating, even if it's $5. Again, if it's $20, if it's $30, if it's $50, $100, whatever. Maybe, again, you know that rich friend that would want to donate a lot of money. Bring it on, right? 30,000 in 30 days is our goal, and we started that clock. So we have been raising money on Facebook. It's over $500 there. As you saw on this one, it's at $70. So help us help other people and save lives. So that's my ask of you. $30,000 in 30 days. Maybe you know an influencer that loves to help causes, but ultimately I don't want another family to experience what our family went through. The unfortunate part is that so many families, even in the last 2 weeks, have had to have that experience, and it's not a fun experience. It's not a fun place to be. And so, however, we can help make even just that small change in people's lives, that's really what we're trying to do. So, thank you so much for watching or listening. Those of you that are listening, make sure you jump either onto the Make Mental Health Matter YouTube channel. You can also go to YouTube. I just said YouTube. Ha. You can go to YouTube. You can go to the Facebook page. There's a Make Mental Health Matter show Facebook page that you can watch because you probably didn't see any of this information. Otherwise, just go to mmhm.org. You can look under resources. Those are the pages that I showed. And then you can also go to, it's under action. So the programs, and it's under action. And that's where the Love Life Live program is. So thank you so much for watching or listening. I go live every single Monday at 5 a.m. or 5 p.m. on Dream Vision 7 Radio, or at 5 p.m. on E360 TV, and that is Mountain Denver time. So no matter what you do, make sure you come back next Monday, and let's hope I have another guest. If not, I'll find some more things to help educate. But if you know anybody that would be a great guest, send them my way. Bye, y'all.